I first and foremost want to thank PEPFAR and CDC. Lorraine and her colleagues are a fantastic team who love Africa. And so over this model, we are looking at our people in Africa, how else can we do things differently. So a lot of the few things I'll mention are outside the conventional way we do things in the health sector. And that has been part of the gap we have had the last 20 years of fighting HIV and AIDS. So the first presentation just describes, for those who did not come to Zambia, what the model is up and about, and what are the key salient points of the model. A bit of background in under a minute. As Lorraine had said, before they came in, we like Zimbabwe had reached a place where our case finding numbers had plateaued, and of course, our dependable donors were saying things that for them to sustain that level of funding, we needed to up the game and see how else can we find our people who are still living positively, but not yet linked on treatment. And so in March 2018, we only had one main facility with a very small budget and 2 outreach sites, not the terminology, outreach sites, where you go to a place, pitch up a tent, make some noise, and leave with the hope of catching a few people. But then I decided to call my staff. There were about 30 of them. And using my background in strategy and leadership, I said, let's for the first time look inside us and see what we have. Among the things we discovered we had was this great faith and love for people. And that was the beginning of what we call the recipe today, where we said, number one, it's not necessarily the responsibility of PEPFAR or CDC or USAID to find the people in Africa, in Zambia, living positively. It's our responsibility. Because most of what we were doing was donor-based. We wanted to please the donor. We wanted to meet the targets. We are so obsessed about reports. And because of that, we were missing the target. What was the target? Real Zimbabweans, real Zambians. And so we said we have to do it for the purpose of legacy of our countries. If somebody dies from HIV-related illness anywhere in the world, do you know what that means? That means that a whole legacy has gone, meaning the kids who are to be born from that person, the kids' kids, and so on and so on and so forth. So that really touched our hearts, and that's how we said we want to overcome, next slide, 5 barriers. And so those are the barriers which I would like to spend a few minutes on. This is proven the same in most of Africa because of our setup. One of our setups I'd like to bring to your mind is most of Africa are in the informal sector. They don't have formal jobs like you do. For Zimbabwe, it's probably 70, 80% or more, maybe 90%. So the rest of Africa are actually in informal sector. They are trying to ply their trade on the streets, in markets, and everywhere else. And so that forms their workplace. Today, or the last 20 years, the language of the healthcare provider, if a defaulter shows back after 2 weeks or 1 month of missed medication, the way they'll be blasted. In Zambia, they'll look at the shoe's face. Even if it's an older person, they'll say, what kind of man are you? Don't you think that you're going to create resistance by not taking your meds on time? And so the issue of customer care. So what we found through this model, this is critical. The third 90 or 95 is helped by a good customer care, because a satisfied client at your facility will feel an obligation to adhere not only for their own health, but to please the doctor or the provider. you establish a healthy relationship. Have you ever experienced where a client just calls you to say, thank you for the way you handle us and for the way you treat us? These numbers we are posting are human beings with a soul, spirit, ambitions, and pride. So the way we handle them is critical. And so customer care becomes almost the number one. Most of our people in Zimbabwe know about the need to test. Why are they not testing? Other than issue of stigma and cost. It's also the fear. How will I be treated? And this is a lifelong treatment. And so the fourth barrier is time. In Zambia, most of the public facilities, people spend between 3 to 4 hours just to get a refill. We don't have time to spend 1 hour. 1 hour is the max for a man. Why? We are providers. Is there anyone who's heard somebody, a lady being told, you are a failure, you can't even provide for your family? What kind of lady are you? What about men? How many men have heard that indirectly? So the issue of time is critical. We cannot do things the same way. And so under customer care, just to mention one thing, what we began doing is we've created what we call a service charter. We promise the client, if you come to a FACT or a ZACH facility, you spend an average of 30 minutes. As charter number 1. 2, you'll be treated in a very, very courteous way. 3, you'll be respected. 4, you'll be given undivided attention. 5, you'll be able to ask any questions without fear or favor. And so we have a charter that we're committing ourselves, and that will be our measure of our service. In our sector, we felt like we know everything because we understand the behavior of the virus, we understand the clinical side of HIV, but then HIV is not only a clinical issue. And that is why most of the transmission is orchestrated by a number of factors and drivers. Among them, poverty, among them, abuse, all these factors coming together. By working alone in our sector, we are missing out the potential leverage we could obtain from existing structures and networks given by 2 communities. Number 1, the local community. You mustn't underrate the power of local leadership in any community. In Africa, because of our background of chiefs, tribes, which are very strong up to now, we have this very good virtue of respecting leadership, especially at the local level. If you have them on your side, they will do 50% of your job in terms of sensitizing the communities, encouraging people to test, encouraging people to stay on treatment. So there is need to leverage relationship. And so the silo mentality of thinking you know everything because you are a medical doctor or you are a clinician or you are a surgeon, I think must end. And so this model has repeatedly proved that people want to receive this service in the environment they are most comfortable with. Last but not least, one barrier was, again, competition. In our sector, we need to move from competition to collaboration. And that's the beginning of success in our country. And so we are very happy to say that in Zambia, the Ministry of Health has fully received this model. They are rolling out to the whole country this model. And we're now training the government staff. They've asked us to train about 9,000 doctors, and especially in customer care. I'm not sure about Zimbabwe, but for Zambia, the mentality in the government sector is something else. And so we're now trying to change that mentality. This one is what most of Africa needs, all of Africa. This is what Zimbabwe needs. And I wish in the next 5 days, I can have a chance to meet some of our leaders in Zimbabwe and see what we can talk about.